Hello everyone, my name is Dr. Shahriar, your mentor for AMC, and so from Shares Medical Academy. So this is the page and the Facebook forum we have, and I hope so you're following that one. So today we're going to talk about the specialist pathway, a very commonly asked question, as you can see. Often doctor asking me by inbox or in my email, like this is like, so I'm a specialist, I'm working in India, I'm working in Pakistan, I'm working in Bangladesh, so can I work in Australia as a specialist actually? So the answer is yes, answer is no, answer partially it is possible. So I want to say basically there are like three outcomes, as you can see, and in this outcome I have organized in that way that it can be compatible, not compatible or partially compatible. Okay, so all these words has lot of depth things, so you can go to the AFRA website to find out more about the specialist pathway actually. So some of the doctors we found is totally got accepted. Now not everyone, like if you're working in Asian country, you don't expect always to be accepted directly, because our see, I'm Dr. Shahriar, I'm from Bangladesh, so my medical education system does not match with the Australian system. If I haven't gone through the AMC, it might not have been matched before actually. But if someone is in specialist and they are planning, they have the expectation, okay, I have done MD, I have done FCPS, I have done some fellowship, so probably I'm going to work there directly, isn't it? But it's not always true. The specialist thing doesn't mean that it's also matching that Australian system. Probably it's not even matching, even it's matching less compared to the MBBS level actually. So the thing is, you have to make it compatible with the system. So often whom are getting successful in this process, it's some of the countries like USA, UK, then New Zealand, Ireland. So some of these topmost countries, their medical education system is directly matches. So the consultant from these countries often directly got the access. So for them that total compatible thing comes often directly. Some of the doctor, when they apply, they don't check their CV properly. Some of them just pass the fellowship and they're expecting directly it is supposed to match, and it does not. So for them it's not compatible. And lastly, there is another thing we call it, like it's probably the partially or substantially. It means you'll get interview, they will give you a certain terms and condition for that one. So what are the terms and condition, maybe we can discuss in another video. So many things, that's the part, it's quite good, that's why it's quite complicated. All right, so this is one of the things. The next commonly asked question, how much is the expense? And I can tell you that's almost like this, not 1,000, this is a 10 extra, this is a $10,000, Australian dollar. In US dollar it comes around almost like $8,000. So you can understand you need a budget for that as well actually, so it's quite expensive. So make sure you are having good practice and good money in your pocket. It might be getting into total waste, that's possible. No one knows is it going to be acceptable or not actually, in that way. Now I have many students, those are in my academy, and often many doctor come to me, they are already working in Australia. So some of the doctor also ask me in that way, even among my student, doctor, how is this person is working already in Australia, then why they are also coming for study under you? And we can see they are also working and they are at the same time studying under us. The thing is, there is another thing that is called the short term, actually the short time specialist pathway. And now that's a different thing. It doesn't mean you are compatible, you have the permanent license to work, or you have the full registration. So now this is a thing, sometimes we can say some kind of limited type of registration actually. So specialist and also some kind of limited time being they are working in Australia. All right, so these two questions for whom it is applicable. So even someone who is in the end part of their specialist system, so example, you are doing the MD course and you have just the final left, or maybe you have just finished the MD course, FCPS course. Now you can, if you think you have a good CV, you can definitely apply and can start working in Australia for 2 years. You will get paid. There's another question that comes, will I get paid? There's nothing without pay in Australia. So it's, of course, except for the typical 1 month observership, I mean everything is paid actually. Is this non-paid thing? I don't know. I mean, I have seen in Bangladesh, I mean many of the doctors feels very sad. I mean there's 6 months, I mean honorary, I mean without any pay. We have seen that one. So there is nothing in Australia like that without pay a doctor is working for months after months. Okay, so there are free things, I mean without pay, I mean that's like a 1 month, but usually every type of doctor job is got paid actually, and paid very well, I can tell you. So, and for how many years? So this short time specialist training, so for how many years they can work actually? So they can work actually for 2 years. So they'll be given time for 2 years. I know at least 8 of the doctors in my academy right now, they are doing the AMC because this short-term specialist training pathway is about to end, because they are almost about to, I mean they have crossed already 1 year. So there is a bell is ringing, ting ting, and they want to finish the AMC. And why they want to finish AMC, let me tell you that one. There is a reason for that one. Can this short time, as you can see, can this short time can be a permanent thing, and that's the reason they enter into Australia actually. I mean it's most cases not because of the training they have entered and want to learn. The main motive is to, I mean, migrate and be there permanently. So is it possible, like we enter into short time program and make it permanent? Answer is yes, that's possible if you pass the AMC later actually. So that's the thing actually. So this is how their visa extension will be renewed more if they pass the AMC 1 at least. So then again they will get more chances. So eventually, the end summary, you need general registration in Australia. I repeat, eventually you need general registration in Australia. So general registration required the AMC, and there is 47 weeks. All right, so I'll talk about the general registration in another day. So but since they're already working, some of the training things might be counted, so all they need is the exam passing actually. So they might get some kind of registration later actually. So we'll talk about that one. What is general registration, what is provisional? Before general there is provisional that comes actually, then comes the general registration. All right, so this is the thing you need to consider. Now, who can apply for specialist thing? Be sure in one thing, you really have to be like many of the professors, they call us, I mean with due respect to all of them, I mean the fluency of the English, the presentation, they might be very knowledgeable, and the thing that at this level the presentation might not be that up to the mark actually. So how to tackle an interview and how you are talking eye to eye, I mean how these are mostly online interviews, so how to crack an online interview, how should be the background, how should be the light, there's so many things, how should be the body language. So everything they noticed. I've worked as also, I mean HR before, so I know these things actually, what are the things that has been noticed actually. So a commonly asked thing, when I'm applying, do I need the English test? Answer is yes. So there are a lot of type of English test, you can pass them, you get the exact necessary bands. You can check in my another video what are the bands that is required for Australian registration. You can find it out from my YouTube channel. I hope you have subscribed already. And now, how much money it is required for applying to the specialist pathway? It's actually $10,000, which I already tell you, $10,000. Actually 10,000, not $1,000. Is it worth applying with $10,000? Now the question is, it depends on you actually. So the answer is probably yes or probably not actually. It depends on your financial status. If you're just past postgraduate doctor, you might not have that much money, but some of the doctors maybe they're earning for 10 years and they have very good practice, so $10,000 might not be that much problem investing. So I would say that's kind of like a gamble actually for the Asian doctors. India, Bangladesh, Pakistan, so many doctors call me often regarding that. Actually, I'm not tired of answering, but we also have to be patient sometimes telling them, and it's not very easy, explaining, the way standard pathway is so easy. This specialist pathway is not that easy, and because they're calling for the first time, they haven't done that much research, so often there's a lot of confusion. So I hope so this particular thing which I just shown you in a crackdown process, I hope so you liked it, and if you have any more inquiries you can ask in the comment section. I will appreciate that. I mean, unnecessary inboxing by Facebook Messenger might not be recommended, because I usually answer in the YouTube channel comment section as well, so no worries. My best wishes to all the doctors, and for AMC preparation and certain inquiries you can email us. That's not a problem actually, and we have the best kind of preparation center for AMC, MCQ, clinical, and we do give guide to our students in each of the session. When I take in AMC, there are few informations like that, always I tell them. So best wishes, and I will catch you guys again. This is Dr. Shahriar. Thank you so much.